Hello, everybody, and welcome back to our How To Corner. In today's episode, we're going to talk about post op recovery from rotator cuff surgery. And before we get started, I'm Will Gray. I'm your friendly neighborhood therapist. And please like, share, subscribe, follow, comment, ask us questions, let us know how you feel about the content. Because what we always try to do in our How To Corner is just basically give information on different things that, our clients have, asked us about and we think are important to share. Because sometimes just having a different voice, a different perspective helps all of us to be able to do better with what we have going on. The agenda for today is we're going to discuss the surgery, the recovery, and the rehab in that order. Um, that is really the three pillars of this whole journey when it comes to a rotator cuff injury, as well as the surgical procedure that has to occur. And I think a lot of people get anxious about it. So in today's episode, we're going to really dive into it a little bit. Now, let's talk about the surgery. The surgery itself can be a very simple or complex process. What I mean by that, the surgery can be as quick as an hour to 3 hours, depending on the size of the tear or the involved structures around it. Some people don't have just a clean rotator cuff tear. I think people think when the rotator cuff tears that, it's one muscle, or that's like a clean tear. Like if you were to cut a piece of paper with scissors, people just, glue it back together. But no, it's really not. It's almost like if you were trying to unwind a piece of fabric, right? Like if I just had a string of cotton or some fabric from a shirt, how a string comes off of that, and you try to unwind the string. If we unwind the string of that fabric, it'll be very hard to tighten it back up or put it back together. It's almost impossible. So there's a lot of skill and guesswork that goes in. So sometimes the surgical procedure is not as quick and easy. Sometimes a little bit dirty. Sometimes there's not good tissue there, right? Now, after the surgery, discharge home the same day is very common. Don't shoot me. That's not me saying that it should be common, but it is. Reason for that, I think, is two reasons. I think that the day of everybody being admitted to the hospital post surgery is very not frowned upon, but people are pushing the envelope on it. I think one piece is insurance. I don't not about you having good insurance either. I think that a lot of times you're doing these surgeries at outpatient facilities that are not attached to hospitals, and they don't really want to admit you because if they do, they lose a certain portion of the money they'll be made with the surgical procedure, and as well as, I mean, they feel like a lot of this can be taken care of home. Don't think the complications with these type of procedures are as difficult. It's like the people at home can take care of you as long as you have a someone with you that can help you with your care. Me, I feel like every situation is a little bit different. I feel like there may be some truth to that and maybe some false to that too. And the reason for that is because a lot of times people are getting sent home without information at all. They're just getting sent home with a sling that's not on right. I've seen that a lot. Getting sent home with medications, but they don't get, the instruction they need to be able to when to take it, how to take it. So they're just chunking medication down their throat. Sometimes, the patient themselves are just, are not really health literate in the sense of understanding or being comfortable with what you're telling them to do, and even their spouse or their loved one is not comfortable with it either. So that's where the false part comes in at, where sometimes the mission overnight is more for peace of mind and them getting some help with looking at the wound, taking the dressing off, putting the sling on, making sure it's proper, make sure it's not any excessive pain. Getting an opportunity to be able to see how the medication is being delivered, around the clock and stuff like that. Now, when you're the person that's getting the surgery, right? Ask all these questions before going home, just like I mentioned above. The questions to ask: how to sleep? Do you sleep in a bed or you sleep in a recliner? Do you sleep elevated, upright? What? Most of the time, you're trying to sleep in a recliner. They don't like allow you to sleep in a bed after this procedure. How long before a follow-up visit? Usually about 3 weeks. They always give a follow-up visit 3 weeks, most likely after the surgery, in order to prep you for your physical therapy, as well as to make sure they see if there haven't been some issues that have arisen during that time. Um, are the prescription medications being called in, before you leave the hospital or the outpatient, setup that you're having the surgery at? How to wear the sling, how to take the sling off, how to put it on, and then changing the bandages. There's usually not a lot of drainage with shoulder procedures, but sometimes there is. Some people bleed a little bit more than others. And then the most important question is, when do you start therapy? Please ask this. I've had a lot of clients, and I'm in Mississippi, just full disclosure. I have a lot of clients who don't always come to therapy, when they're supposed to, and it's not their fault. Sometimes the doctor gives them orders to not go to therapy until 6 weeks after their surgery. And I've seen those orders written. I've read them. I saw them. So this happened. Some are 3 weeks post-op, which is fine. So there's a lot of situations where sometimes the client doesn't want to go because they feel like it's going to be painful. So there's a lot going on there. Number one. Now the recovery. How long does it take to recover from this surgery? Honestly, man, there's 6 to 12 months of actual recovery. What I mean recovery, there's stages of recovery. Some people can get it done in 6 months because they don't have a high level thing they're trying to get back to. They're not an overhead athlete. They're someone who's, just trying to make sure they can do their hair, wash their back, and be pretty, maintained in that. And some people, it's a 12-month ordeal because they're having to go back to work, having to lift heavy equipment, having to do a lot of overhead work, maybe a lot on their back, maybe having to crawl, climb. And then some people are playing a sport like, baseball, football athletes. And in addition to playing those particular sports, it requires you to, do a lot more overhead and a lot more strenuous activity with that shoulder. So it really ranges on your, quality of life you're trying to return to. Now, with that, there are some expectations that you need to, kind of be aware of. One of the expectations is that, will you be in pain? Yes. How long? It could be your first 3 days after surgery. It could be your first couple of weeks. It really depends on, use of medication, modalities, how bad the procedure was, what they had to do to your shoulder. Do you need to take pain medications all the time? No. I like when they prescribe it as needed, and they try to get you on a regimen to start with early, maybe the first 3 to 5 days. This is what they want you to do, and then they try to, basically pull you off of them or tie you off of them. That's why I only give you a handful of them to use anyway. You should really be trying to use some modalities like cold. It's very, very helpful. Is it a very up and down recovery due to the shoulder being a very unstable, stable joint? That's not really a question. It's me making a statement. Yes, it's a very, very, very up and down recovery. That shoulder, having that type of mobility in that shoulder really makes it tough to be able to get a clean progression all the time. And then sometimes it's not. Sometimes it's easier to get a pretty clean progression. Like, I think that overall, that a lot of time in this recovery, we are a little bit, how can I say this, blocked by different reasons or reasonings. Now, the rehab. Usually, the rehab itself is usually going to start 3 weeks post-op for most common, situations. Range of motion, muscle re-education is mostly important, right? Because you want to make sure you get as much range as possible. And this is usually from the first day you get in rehab. It's about 6 to 8 weeks, after that first day in rehab. A lot of people like to say, "Well, I'm 6 weeks out of surgery. I should be moving my arm." You came to rehab at week 3. It's going to take you about another 6 weeks from that point to be able to get to that place. So we're trying to arrange you as much as possible. And then what you're doing at home. Are you doing anything at home, or you're just babying the shoulder? If you're babying the shoulder, then you're not going to be able to get to that particular point. Just coming, that's a two-way street there. But getting your range as much as possible, activating all those muscles that were cut and you know um, suture back together is really important. And then realizing that at a certain particular point in time, certain milestones should be already reached, especially a range of motion milestone by week 8. I think should be covered. Now, strength can be focused on after range of motion is acquired. You can get your strength. You have some atrophy there, period. But if you don't have the range of motion, then it's very hard to really try to start getting strength. And believe it or not, some of the range of motion can be restricted by your weakness. So, but you need to make sure that the patient, if you're a therapist or if you're a patient, make sure that you can passively go to those, milestones as far as in comparison to either to your other shoulder or in relation to the surgical procedure you had. Sometimes procedures are so complex that you can't progress as quick or you don't progress to that particular point equal to your shoulder or close to it, and it's really dependent on a few different things. Now, make sure you use your pain medication and heat, ice and heat to help offset pain as rehab becomes more challenging, which is why you don't want to be just chugging pain medications all the time. You want to be able to try to space them out and try to, go back and forth between heat and ice to be able to help with a lot of your pain that you have going on when your rehab starts to become a little bit more challenging, whether having to really stretch your arm, push you through some range, try to make sure they get all of that range back. And lastly, this will take time. Don't rush it. The recovery from a shoulder, surgery is very, very, very tough sometimes. And sometimes very, very cool and very clean. When I say clean, I mean that, the progressions are pretty much to be expected. The pain is what you expect. The range is coming well. It's just everything is just kind of going together. But it will take time to get you all the way back to the quality of life that you used to have, or some remnants of it to make you be able to be satisfied with that. And as a result, don't try to rush it, but make sure you do your part from a therapist standpoint as well as from a patient standpoint to help with that happening a lot quicker. For everybody who's made to this particular point in the talk, man, thank you so much. We really appreciate you all pressing play and getting to this particular point of the slide and the presentation, because the only thing we're trying to do is educate and share information. And I think a lot of times that is usually the thing that a lot of us, need. We just need a different voice or somebody to be able to help us, understand something, or maybe I said something or you saw something in the slide that you wanted to know, to put you at ease or be able to help you get over the hump of what you have going on in rehab. Now, if you looking to follow us on different platforms, obviously on YouTube, obviously we're here because you're listening to us here, but we also can be found on Instagram, Facebook, as well as TikTok, giving out different information because we're just trying to educate the people who we treat and who we take care of. And if you have any questions further than that, you can always DM us and we'll try to reach back out to you as quick as we can concerning any of the injuries you have. And with that being said, I hope you have a blessed one. I'll catch you in the next one.